Hello guys, hope you're all okay. You're all enjoying your life and you're also enjoying watching my ultrasound and radiology teaching videos. Today my topic of discussion is uterine fibroids and pregnancy. And the question is whether this fibroid or these fibroids affects the viability of the pregnancy or not. So far the answer is concerned, there is multiple angles and there is multiple options with the fibroids and the pregnancy, depending on the size of the fibroid, depending on the age of the gestation, and depending upon the site of the fibroid. These three are very important questions to be answered. So the first thing is, if the fibroids are small enough and it is placed in the periphery of the uterus, it might not interfere with the pregnancy growth. And if these fibroids are large enough to put the pressure on the uterine cavity, so it may leads to the termination of pregnancy. Beside this, you have to look for whether the pregnancy is within 6 to 12 weeks. So during 6 to 12 weeks of gestation, these uterine fibroids effects on the pregnancy growth, and it causes some trouble and it causes some pressure on the uterine wall and endometrial wall, and not letting the pregnancy to grow bigger. But if the pregnancy is from 12 onward, so it is likely that the hormones of the pregnancy may shrunk the uterine fibroid and the pregnancy will progress. That's why in many cases, when the patients comes with having a multiple fibroids and they wanted to conceive and wanted to be on the family way, we usually advise them to wait and watch and to get pregnant, because during the pregnancy, the hormones which is secreted during the pregnancy having an effect on the uterine fibroid to get it shrunk. So that's why this is one of the very important encouraging point, that if there is fibroid, just let it, instead of going to have the myomectomy, just leave as it is and try to be on the family way. Once you are pregnant and the pregnancy hormone starting releasing, so it will affect the uterine fibroid and it will get the fibroid shrunk. So this is what all the literature and the knowledge regarding the uterine fibroid and the pregnancy you can read within the literature and books as well. But in this video I have selected one of the image in which the patient was pregnant and there was an interior wall fibroid, and the pregnancy progressed until the delivery. So let's start watching this video. Abdominal ultrasound of pregnant lady, and here you can appreciate that intrauterine gestation is viable and active pregnancy. Beside this, if you focus on the anterior wall, you will be able to see a well-defined heterogeneous round fibroid, and this round fibroid having an compression effect on the anterior wall of the uterine cavity. So there may be a possibility of miscarriage, abortion. So therefore, whenever you are doing obstetrics ultrasound, you must pay attention to the surrounding myometrium and for any developing fibroids. In this case, there is a great chance that this pregnancy might terminate, and you should have to take extra care and keep the patient in observation.